Hey friends, welcome back to Learning Nails and Aesthetics. We are in the Milady Esthetics book, Chapter 4, Skin Foundations, Disorders, and Diseases of the Skin. Starting on page 148, we will go to page 156, and then in an upcoming video will be the Chapter 4 glossary. Keep in mind, I am not AI. Mistakes will be made. Just laugh along with me. So, 148. Let's get to it. Identify the types of hypertrophies. Hypertrophy is defined as an abnormal growth. Many are benign or harmless. However, some growths are Sorry. I was going to sneeze. Premalignant or malignant and can be dangerous or cancerous. The term hypertrophic is used to describe thickening of a tissue. The opposite of hypertrophy is atrophy, which means wasting away or thinning. Keloids are an example of hypertrophies. Types of hypertrophies include the following: hyperkeratosis, thickening of the skin caused by a mass of keratinocytes. Keratoma, an acquired thickened patch of epidermis. A callus caused by pressure or friction is a keratoma. If the thickening also grows inwards, it becomes a corn. Keratosis, plural keratoses, an abnormally thick buildup of skin cells. Keratosis pilaris, redness and bumpiness in the cheeks, upper arms, or thighs caused by blocked follicles. It has the appearance of chicken skin. There is an example picture, figure 4-23. It is not well understood, but is often genetic and disappears after the age of 30. Many young women feel self-conscious about this condition and will seek an esthetician's help. Topical chemical exfoliants that keep the follicles free of keratin, like alpha hydroxyl acid, an AHA, or beta hydroxyl acid, a BHA, products, along with light mechanical exfoliation, can help unblock follicles and alleviate the rough feeling. Care must be taken to prevent too aggressive an approach and disturb the acid mantle balance, causing dermatitis or infection. Mole, a pigmented nevus, a brownish spot ranging in color from tan to bluish black. Some are flat, resembling freckles. Others are raised and darker. Most are benign, but changes in mole color or shape should be checked by a physician. Hairs in moles are common. The hair may be tweezed from a mole if the client desires. The belief that hair in moles should not be removed is an old wives' tale. Moles should be observed for changes within the American Cancer Society's ABCDEs of melanoma check. Psoriasis is an itchy skin disease characterized by red patches covered with white, silver scales caused by an over-proliferation of skin cells that replicate too fast. Figure 4-24. Psoriasis is usually found in patches on the scalp, elbows, knees, chest, and lower back. If patches are irritated, bleeding can occur. Psoriasis is not contagious, but can be spread by irritating the affected area. It is thought to be an autoimmune disorder, and clients experience flare-ups that can be controlled with oral or topical medications. Light therapy is also thought to be helpful. Clients with psoriasis are often also diagnosed with cardiovascular disease. Skin tag, small outgrowth or extension of the skin that looks like a flap. They are benign and are common under the arms, on the neck, or breast area, caused by friction. I find that powder helps prevent skin tags. Just a little tip there. Check in. What are 4 hypertrophies of the skin? How is keratosis pilaris treated? Define 9 contagious skin and nail diseases. The term contagious disease is used interchangeably with the terms infectious or communicable disease. Do not perform services on anyone with a contagious disease because it can spread and infect others. Refer them to a medical professional. The following are contagious diseases. Conjunctivitis, also known as pink eye. Inflammation of the mucous membrane, which is the conjunctiva, around the eye due to chemical, bacterial, or viral causes. Very contagious. It can be treated with antibiotics. It can also be prevented by washing your hands and avoid touching your eyes when possible. Herpes simplex virus 1. Fever, blisters, or cold sores, recurring viral infection. A vessel or group of vessels on a red, swollen base. The blisters usually appear on the lips or nostrils. Figure 4-27. Herpes simplex virus 1 causes cold sores and lesions around the mouth. It is a contagious disease. Treated with antiviral medication to shorten the outbreak. Herpes simplex virus 2, genital herpes, never work on clients with active herpes lesions. Figure 4-28. Peels, waxing, or other stimuli may cause a breakout, even if the condition is not currently active. The virus can be spread to other areas on the person that is infected or to other people. This is an example of why reviewing the client intake form is important. Herpes zoster, also known as shingles, a painful skin condition due to reactivation of the chickenpox virus, also known as the varicella zoster virus, VZV. Shingles is a viral infection of the sensory nerves characterized by groups of red blisters that form a rash that occurs in a ring or line, figure 4-29. The rash is typically confined to one side of the body. VZV can cause nerve and organ damage along with severe pain that can last for months or years. Treatment includes antiviral drugs to shorten the length of the outbreak. Infantigo, a bacterial infection of the skin that often occurs in children, characterized by clusters of small blisters or crusty lesions filled with bacteria. Figure 4-30. It is extremely contagious. Oral and topical antibiotics are used in treatment. An untrained eye may misinterpret infantigo and assume herpes, acne, or dermatitis. Professional medical intervention is the correct course of action for your client. Onychomycosis, fungal infection that produces symptoms of thick, brittle, discolored nails. Figure 4-31. The fungus lives off the keratin in the nails. Onychomycosis can be challenging to eradicate because fungus likes to grow in dark, moist places, and shoes can be the perfect environment. Clients can feel embarrassed about the appearance of the nails and discouraged during a course of treatment because of slow nail growth. Estheticians can encounter this when doing body wraps or during hand and foot massage with a facial. If it is discovered, the facial treatment can be continued, but the esthetician should not continue with the hand-foot massage. Figure 4-29 is a picture of herpes zoster, also known as shingles. Is characterized by groups of red blisters that form a rash in a ring or line. Figure 4-30, impetigo, is characterized by clusters of small blisters or crusty lesions filled with bacteria and is extremely contagious. Figure 4-3 is the onychomycosis, is a fungal infection that produces symptoms of thick, brittle, discolored nails. Figure 4-32, tinea corporis, also known as ringworm, is caused by a fungus that spreads into red and scaly circular infection. Tinea, fungal infection. Fungi feed on proteins, carbohydrates, and lipids in the skin. Tinea pedis, athlete's foot, is a fungal infection that can be treated with antifungal topical powders, sprays, or creams. Estheticians can encounter this type of infection when doing body wraps or during hand and foot massage with a facial. If you are reviewing a client's intake form and see the word tinea, you will know that the client has a fungus, and you should determine the location prior to treatment. Tinea corpus, also known as ringworm, caused by a fungus. Nope, I have the hiccups. Is not a worm. It looks like a skin irritation that spreads into a circular infection that is red and scaly. Figure 4-32. It can be dry or moist. It can be spread by direct contact as well as indirect contact with items that have touched the skin of the infected person. Pets can carry it. It is important to use a fungicide to disinfect items that have come into contact with the client who has the infection. Excuse me. Including clothing, blankets, and towels. It can be treated with either oral or topical antifungals. Verruca, also known as a wart, a hypertrophy of the papillae and epidermis caused by a virus. They are not cancerous, but they are contagious. Verrucas are typically flesh-colored, but can be brown or black. They can appear singly or in clusters. Figure 4-33, brown or black. They can appear single. I just reread the same line. Verrucas are not well understood. They can spontaneously disappear, but there are several treatment options, including cryotherapy, electric therapy, surgical excision, and chemical exfoliation. Chemical exfoliation involves the application of a strong salicylic acid at home that peels the wart off in layers. When treating a client with warts, it is imperative that you wear gloves to avoid spreading the virus to other locations on the client's body or inadvertently to another client. Check-in. Name and define non-contagious skin and or nail disorders. Which contagious diseases contraindicate skincare treatments? Caution. Do not work on clients if they have an open verruca, commonly called a wart, or any other contagious condition on any area that would contact the client. Do not touch clients' warts or plantar warts on the feet because these are contagious viruses and you could inadvertently spread the virus. Identify 2 mental health conditions that may manifest as skin conditions. Dermatillomania is a form of obsessive compulsive disorder, OCD, in which the person picks at their skin to the point of injury, infection, or scarring. A person with this condition finds the picking stress relieving and not painful. It can often be socially isolating because severe dermatillomania can be disfiguring. Uninformed people may assume the person has a methamphetamine addiction. Treatment includes cognitive behavior therapy, hypnosis, and medication. Body dysmorphic disorder is a psychological disorder in which the client has a preoccupation with their appearance. They do not have a realistic picture of what they look like. They tend to fixate on minor appearance imperfections and see them as disfiguring. They believe others are viewing them negatively because of their physical appearance. They may check the mirror frequently and need an abnormal amount of reassurance that their appearance is acceptable. They may be spa hoppers, or they have a history of many cosmetic surgeries or treatments to fix their perceived flaws. They are dissatisfied with the outcome after treatments. This client will be challenging to manage and will require medical intervention with cognitive behavioral therapy and medication. Focus on scientific research. When researching topics, keep an open mind and determine the reliability of the source providing the information. What is found to be true one year may change with new evidence and discoveries. This is true of many topics, including the skin and health sciences. It is important to dig deeper to verify and analyze what we are reading. Just because it is in print or on the internet does not make it true. And this is true with many things, not just skincare and medical things. Check in. Describe dermatillomania and how it is treated. Explain the behavior of a person with body dysmorphic disorder. Body dysmorphic disorder. Recognize common skin conditions related to skin diseases and disorders. The skin conditions in Table 4-6 are often symptoms of more than one skin disease or skin disorder. Several of them look very similar to another. If you encounter these conditions, you will need to make an assessment and judgment about treatments. Perhaps a condition is the result of an infection, or is it the appropriate clinical endpoint of an effective treatment? Having confidence in identifying these conditions will give you confidence when determining a treatment plan and also give your client confidence in your skills. Furuncle, also known as a boil. A subcutaneous abscess filled with pus caused by bacteria in glands or hair follicles. A carbuncle is a group of boils. Edema, swelling from fluid imbalance in the cells or from a response to injury, infection, or medication. Erythema, redness caused by inflammation. Folliculitis, hair grows under the surface instead of growing up and out of the follicle, causing a bacterial infection. These ingrown hairs are common in men, usually from shaving. Also referred to as Barbe folliculitis, folliculitis barbae, Psicosis barbae, and barber's itch. Pseudofolliculitis, also known as razor bumps, resembles folliculitis without the pus or infection. Pruritus, the medical term for itching. persistent itching. Steatoma, a sebaceous cyst or subcutaneous tumor filled with sebum, ranges in size from pea to an orange. Usually appears on the scalp, neck, and back, also called a wen, spelled W-E-N. Check in. Describe edema, erythema, and pruritus. Explain 5 sudoriferous gland disorders. Disorders of the sudoriferous glands include the following: anhidrosis, a deficiency in perspiration due to failure of the sweat glands, often results from a fever or skin disease. Anhidrosis requires medical treatment. Bromidosis, foul-smelling perspiration, usually in the armpits or on the feet. Bromidosis is caused by bacteria and yeast that break down the sweat on the surface of the skin. Hyperhidrosis, chronic excessive perspiration caused by heat, genetics, stress, or medication. An FDA-approved treatment for hyperhidrosis includes the use of microwave technology to destroy the underarm sudoriferous glands. One treatment is usually up to 80% effective. Neuromodulators like Botox Cosmetic are also used to inhibit the sudoriferous gland production. Diaphoresis, excessive perspiration due to an underlying medical condition. Menopause is an example. Milariaoba, also known as prickly heat, acute inflammatory disorder of the sweat glands, results in the eruption of red vesicles and burning, itching skin from excessive heat exposure. Recognizing a potentially contagious skin disorder can stop the spread of infection. You can formulate a more specific treatment plan and use the appropriate products when you can identify common skin disorders, such as rosacea and acne. Understanding that some skin disorders are contraindications for treatment will help you avoid a negative outcome. The medical field is progressing, and the treatment of skin disorders and diseases is becoming easier with advances in technology, ingredients, and medications. Although there are hundreds of disorders and diseases, the majority of the ones you may commonly encounter are discussed in this chapter, along with some that are unique. Knowledge of skin problems takes years of experience and study, but reference books and credible medical websites are helpful in identifying these disorders and diseases. Check-in. Explain 5 sudoriferous gland disorders. Web resources: dermnet.com, phil.cdc.gov, and that's phil.cdc.gov, medicinenet.com, rosacea.org, skincancer.org, pcosaa.org, impactmelanoma.org. Competency progress. How are you doing with disorders and diseases of the skin? Check the Chapter 4 learning objectives below that you feel you have mastered. Leave unchecked those objectives you will need to return to. Explain why knowledge of diseases and disorders is valuable for an esthetician. Describe how an esthetician and a dermatologist can work collaboratively. Identify the differences between primary, secondary, and tertiary skin lesions. Recognize skin changes that can indicate a type of skin cancer. Describe the types of acne. Describe the symptoms of polycystic ovarian syndrome, PCOS. List common vascular conditions or disorders. Identify pigment disorders. Describe the different types of dermatitis. Identify the types of hypertrophies. Define 9 contagious skin diseases. Identify 2 mental health conditions that may manifest as skin conditions. Recognize common skin conditions related to skin diseases and disorders. Explain 5 sudoriferous gland disorders. And that'll do it for this video. In an upcoming video will be this chapter's glossary, chapter 4, disorders and diseases of the skin. Please comment, like, share, and subscribe, and check out my other videos. I appreciate you watching. I hope this was helpful to you. Have a great day. Thanks. Bye.